Hello everyone, this is the last part, the conclusion, when we will have a recap of the key points, encouragement to seek professional help, concluding thoughts and recommendation. As we all know, this is a guide to family consultancy and how it can improve family relationships. It explains what family consultancy is, the benefits it can offer, the different types of family consultancy, and what to expect during each session, and how it can help strengthen relationships by providing an unbiased space to communicate, work through conflicts, practice problem solving skills, and gain insights into the dynamics of the family. Family consultancy can also help families identify and address underlying issues, cope with difficult emotions, and move forward in a healthy and positive direction. We all have discussed family therapy, which involves educating, counseling, and teaching coping techniques to families affected by various psychiatric issues. Family therapy aims to enhance communication, to manage family problems, understand and resolve particular family conditions, and establish a better functional home environment. The therapist should establish good communication skills, empathy, keep up to date with research, remain ethical standards, develop specializations, collaborate with other professionals, and cultivate self-care practices. Furthermore, cultural sensitivity and maintaining control of sessions are important issues to consider in family therapy. Additionally, there are communication organizations and nonprofit groups that offer support and counseling services for every family that is in need. These organizations may specialize in particular issues such as substance abuse, domestic violence, or child and adolescent mental health. They may provide counseling services, support groups, educational resources, and referrals to other community resources. Examples of such organizations include the National Alliance of Mental Illness, Substance Abuse, Mental Health Service Administration, and the National Institute of Mental Health. It is important to note that seeking psychological consultation or counseling services is not a sign of weaknesses or failure. It is a proactive step towards addressing and resolving issues within the family. By seeking help, family members can learn valuable skills, gain new perspective, and strengthen their relationships with one another. B. Encouragement to seek professional help. It is important to recognize the warning signs. Understanding the signs and the growing symptoms or deteriorating mental health condition is the first step in delivering mental health first aid. Although only qualified experts can identify a mental illness, you may notice changes in a person's mood, behavior, energy, habits, or personality. These changes might indicate a mental health issues. Among the signs that may suggest a major conditions are bizarre or unusual thinking, marked decrease in activity, difficulty concentrating, significant drop in performance at work or school, significant withdrawal from friends and family, sleep issues, changes in weight or appetite, being aloof or silent, substance abuse problems, feelings of remorse, of worthlessness that have endured for more than 2 weeks. Having one or two of these symptoms does not usually indicate a mental illness, but if a person has several symptoms, they may require professional help, especially if the symptoms have been present for several weeks or are interfering with one's usual activities. These warning signs or symptoms in others must not be overlooked, and don't think they will go away. Remember that not everyone will have the same symptoms or tolerance. Strongly encourage someone to get treatment for mental health issues. Inquire whether the persons required assistance in dealing with their emotions. A visit to their doctor is a terrific place to start if they desire support. They may also discuss your alternatives with them, particularly local or internet providers. Urge them to take action on their choices. If the person refuses to accept assistance, attempt to figure out why. They may have some assumptions about receiving assistance or other alternatives. Make them feel better about obtaining help. If the person continues to refuse aid, inform them they may contact you if their mind changes. Respect their freedom not to seek treatment unless you fear they are in an imminent danger or hurting themselves or even others. Certain behaviors, such as reaching out to someone they suspect may have a mental health problem, should be avoided. These behaviors include telling them to snap out of it or get over it, being hostile or sarcastic, becoming over involved or overprotective, nagging, trivializing their experiences, battling or dismissing their feelings, being patronizing, and attempting to cure or solve their problems. Support services should develop a mental health promoting strategy. This includes providing education on mental illness to all staff and students. Support services should prioritize urgent and severe cases and tailor their services to culturally appropriate. Additionally, support services should make students aware of confidentiality and provide documentation outlining the impact of mental illness on their studies to facilitate discussion regarding reasonable adjustments. Lastly, a contact person should be available to talk to kids who have returned to study after periods of mental illness to discuss achievable standards and goals and rearrange necessary academic support. For parents, it is naturally for them to want to be with their child to help them through difficult times. However, sometimes outside help needs to be ensured for the best outcome. Sometimes more guidance is needed in order to raise a child, considering attending a parenting course or seeking professional help if is recommended, even for the best unproblematic parent. Remember, parents can help reduce the stigma surrounding mental health problems by demonstrating a non judgmental attitude towards those who are struggling. Seeking help when needed is a sign of strength and can lead to positive outcomes for both parents and child. In conclusion, seeking psychological consultation for families can be beneficial in addressing a variety of issues such as difficulty managing emotion and behavior, communication breakdown, unresolved conflict, marital or relationship problems, major life crises. Psychologists can help families by providing coping mechanisms, enhancing communication, teaching behavior modification, emotional management, and conflict resolution techniques, addressing underlying concerns, developing empathy and understanding, and creating a family plan. A family could benefit from psychiatric counseling, including levels of high stress or anxiety, frequent disagreements or fights, reduced interest in family activities, sudden move or behavioral changes, significant changes in family dynamics, and issues regarding child or adolescent development or behaviors. All these are very important signs. Families can still seek help from online counseling, school counselors, or directories or databases to find certified therapists in their regions that provide family counseling services suited for their needs. That was all. Thank you all for listening. I really hope it was helpful.